Welcome back to the Research and Education Foundation Conference on COVID. We're delighted to have you back after lunch. And we've got a really exciting end coming up to the conference as we discuss sort of national opinion and COVID. And this has been so vital to our response. We've got three really exciting speakers that I'm looking forward to hearing. First of all, before that, we're going to have Richéal Burns, who's going to talk about the development of a sort of research centre within IT Sligo and tell us about that for the next 5 minutes. And then we're going to have Mr. John Kelly, one of the orthopaedic surgeons in Sligo, who's been helpful in sort of supporting the conference. And he's going to be the chairperson for this session. And he will respond to the questions. Notably, if you put your questions on chat on Zoom, we will try and include them in the discussion afterwards. So we look forward to joining you. And for now, we'll move to Richeal, who's going to give us a 5-minute presentation. Thank you, Richeal.
Thanks, Anna. And thanks for allowing me the stage just for a few minutes to present on, I suppose, a new venture here at IT Sligo, soon to be the Atlantic Technological University. And I want to introduce a new health and biomedical strategic research centre that we're just launching now in IT Sligo, and that was funded through competitive internal competition. So I suppose in the spirit of everything that we've heard so far today and everything that we are promoting through this conference in terms of shared mentorship and research expansion through collaboration with the Research Education Foundation, both within this catchment area of the Northwest, but also nationally and internationally, I suppose, leading experts in the area of health and biomedical science have come together in IT Sligo, and we are forming currently its newest strategic research centre, bringing it up to the number of 5 strategic research centres within IT Sligo. So in terms of the 4 pillars within the Health and Biomedical Research Centre, which we're calling HEAL, there is a pillar on population health and clinical research, and that will be led by Dr. Laura Keever. A pillar on digital health technologies, led by Dr. Conrad Mulrennan in the IT Sligo. A pillar on biomedical and wearable technologies, led by Dr. Jared McGranahan, and health and analytics, evaluation and policy, led by myself. So as you can see here, we have, I suppose, an expertise between us looking at lots of different areas, both clinical areas, methodological areas, digital transformation areas, e-health areas, but I suppose the general sense of what we're trying to do is promote research across the health sphere from the conception of an idea that might improve health to its outcomes in terms of being put into practice and how that affects patient and healthcare delivery in improving functionality and outcomes for society more generally. In terms of current research themes, this is just a collection of the research areas that our 19 investigators are involved in currently. And I suppose the main message here today was just to highlight that we have developed this strategic research centre. We want to get involved in more research with our extended partners across the Atlantic Technological University and also with the Research and Education Foundation. And we are interested in all aspects of health and social care research and how that informs patient care pathways and enhancing health outcomes for society more generally. So for more information, we have our email up and running. Our website is currently under development, but you can contact HEAL SRC at itsligo.ie. And thank you for giving me some time here today.